Good evening, Mayor and Councilmember Lim. It's our pleasure to be in front of you guys again today to give the latest update on where we're at with the COVID-19 pandemic, and then to, more importantly, take any questions you may have. So we'll go ahead and start the presentation, and if we could go to the next slide. So one thing you're probably seeing in the news, and we're hearing a lot from the state, is the hospital capacity is at a pretty serious point right now, where we have our flu respiratory illness surge that is coming, and at the same time, our hospital system is stressed. There is a concern at the state level about the level of hospital capacity going into November. So we're just going to have to continue to watch that over the next couple of weeks. We don't know what that means yet. I'll talk a little bit about it in the policy slide, but at this point in Broomfield, we're going to continue to monitor that. And our best advice to people is, given the high transmission of COVID right now in the state and metro region, continue to take the precautions we've been sharing before. The other thing is, a key takeaway is our hospitalizations or deaths are primarily among those counties with the lowest vaccination rates. This is nothing new, but we had the governor present a slide that I'll discuss later that shows hospital admissions by region. And what you'll see is we're seeing a lot of the hospital admissions coming from counties outside the Denver metro area, which again is concerning because of our ability to do additional mitigation efforts and what we need from those surrounding counties. As far as case rates, we're seeing a substantial decrease nationally, which is great. But we're seeing that Colorado continues to be in this high plateau, and we don't know what's playing into that. We all project that there's some seasonality there. If you look at the Health and Human Services Region 8, which includes North Dakota, South Dakota, Utah, Wyoming, Colorado. Most of those are northern states, and that's where we're seeing a bunch of the high case rates. So it might be due to people moving more indoors and seeing higher community transmission. The FDA, as we shared on the town hall, approved booster shots from Moderna and J&J. And then tomorrow, the FDA will review Pfizer's submission for their vaccine for 5 to 11-year-olds, which is wonderful news. And again, we're going to continue in Broomfield to mitigate disease transmission in our high-risk settings. We know that other counties are enacting stronger mitigation efforts or looking to enact stronger mitigation efforts, and the state is exploring that as well. Here in Broomfield, we'll focus our energy and efforts, since we have such a highly vaccinated population, on providing boosters to our eligible residents, and then again vaccinating our ages 5 to 11-year-olds when they're eligible. So next slide. So I talked about these state trends, but what I really want to emphasize is we're still seeing that the Delta is the main variant in the state, and we've heard of the other potential variants that are out there, but they're having a hard time actually starting to increase in their proportion of cases, just due to the high transmissibility of the Delta variant. But we'll continue to monitor that. And then again, hospitalizations, we know, are increasing, and they're primarily among those that are unvaccinated. Broomfield is in a sustained decline, and our percent positivity is 5.8%. I think our cases may have went up today, and our percent positivity may have went up today as well. 71.8% of our total population is fully vaccinated. That's great. And again, once we see our 5 to 11-year-olds, we expect that to go up. And then our North Central region, the coalition is seeing a 15% increase in COVID patients over the previous 7 days. And the majority of our breakthrough hospitalizations, both in the state and here in Broomfield, are among the 70+ population. So again, that's a reminder, if you are eligible for the booster and you're past that 6 months, really encouraging you, if you're in the older adult population to go get it. Next slide. So this just shows where we're at as far as statewide hospitalizations, and what you can see, it's still going up. And the reason we're at a stress is due to a variety of factors. One is that people were putting off seeking care during the previous months of the pandemic, and now they're going back in for that care, and that's taking up hospital beds. We're also seeing that there are staffing issues or staffing shortages in some of our regions as far as in the hospital system. And then lastly, again, when you have a greater proportion of COVID patients taking up rooms and staffing, it leads to the hospital system not being able to do normal procedures. And we're seeing that start to happen. I'm sure you're hearing it from some of your friends and family members of either wait times or not being able to get in for some of those specific surgeries or procedures that they need. So we'll continue to monitor and see where this goes in the state. Next slide. So this is that slide I was referring to, where we had the state run this, the Metro Denver Partnership for Health asked them to run it to see where are the vast majority of the hospitalizations coming from in the state, given our ability to do mitigation measures through public health orders versus what we're seeing in some of the surrounding counties. And what you can see from this slide is that the 7-county metro area makes up 56% of the state population, but we're accounting for 39% of the actual hospitalizations. Whereas some of our other counties make up a smaller percentage of the total population, but are accounting for a greater proportion of those that are being admitted to the hospital. The point here is we could keep doing mitigation and public health orders in our counties, but without the rest of the state being able to implement it, we're going to continue to see this high disease transmission and the stress on the hospital system continue. Next slide. And this further demonstrates what I was talking about before with the 70 plus being our greatest age group, where we're seeing breakthrough hospitalizations. And in addition, we're primarily seeing those that are unvaccinated that are being hospitalized or in that 50 plus age group. But as you can look down on this graph, you see more and more breakthrough hospitalizations as you get into the 50 to 59, 60 to 69, and 70 plus. On a positive note, for our 12 to 15 and 16 to 17-year-old age groups, where we have our public health order in place, what we're seeing is very few breakthrough cases in those age groups. So our vaccine percentage in the county, along with some of the other mitigation efforts that the schools have put in place, are making a difference. Next slide. And this just further illustrates that. I think it's a huge success that as a city and county, we have not seen a substantial amount of outbreaks, whereas we're seeing it more across the state. So you can see from this as of October 20th, there are 64 active outbreaks in schools in the K through 12, just our north central region. That's not the entire state. And here in Broomfield, we have 3 outbreaks in schools, and those are all in the monitoring phase, which means once they enter that outbreak status, they're in it for 30 days, and we monitor to see if there's more cases. I do want to mention, though, we are seeing outbreaks in healthcare facilities, and we do have an outbreak in one of our long-term care facilities. And again, that's concerning, and we've really focused our efforts with the state on making sure that we got booster vaccines to our long-term care facility residents to help with breakthrough cases and breakthrough hospitalizations. Next slide. And this just shows where we are as far as incidents. I already addressed this. Next slide. And here's what I was talking about when we look at breakthrough cases and vaccinations. So what you see is in August, September, and October, we're seeing a fairly steady number of breakthrough cases, and that's not unexpected given we're seeing waning immunity with the vaccines. And additionally, we have such a highly vaccinated population. So over 42% of our cases in August and September were among those that were fully vaccinated. Again, a reminder to those individuals that are fully vaccinated, as you're waiting for your booster, to continue to follow those public health measures that we've advised all along. Then if we could go to the next slide. This actually shows with hospitalizations, and we're still seeing the majority of our hospitalizations are occurring among those that are unvaccinated in Broomfield. And it's hard to make conclusions because our numbers are so small, but this tends to trend with what we're seeing in the state. Unfortunately, we did have 2 deaths in October among fully vaccinated individuals. And my understanding is those were in long-term care facilities. So again, we want to do our best efforts as possible to vaccinate those staff members at those long-term care facilities, as we've worked on and have done, and also increasing booster shots among the residents there. Next slide. So this just shows where we're at as far as our total population that's vaccinated, and we'll start adding that 0 to 5 or 5 to 11, age group, which is over 5,000 Broomfield residents to this, which we expect then will increase our overall total population fully vaccinated. I fully anticipate we're not going to make much more of a dent in the eligible fully vaccinated age group. I think we've hit all of those individuals in Broomfield that want to get vaccinated or have. So again, we're going to focus our efforts on providing boosters to those that have not got their booster shots yet. Next slide. And I was curious, so we broke this down. I wanted to see where our additional doses, and you'll remember these are additional doses for the immunocompromised, and also the additional doses account for booster shots, where those are going. And we just had the Moderna and Pfizer or Johnson & Johnson vaccines approved last Friday. So this was primarily Pfizer that was going out as far as the booster shots. And what's great to see is we're seeing a higher uptake of the booster shots in our older adult population. And so when you looked at all the previous slides with breakthrough hospitalizations, these are the populations that we want to see get the booster shots. Next slide. And thankfully, the state is doing a much better job of record keeping in our state database with race and ethnicity and vaccinations. And so we're tracking our additional doses or our booster shots by race and ethnicity. And I think what is good to see on this is that we are seeing a much better uptake in our Hispanic population and also in our multi-race populations. And so we were worried about seeing some increased disparities here. And you'll recall when we presented this data with the first rollout of the vaccine, we had quite a few people that were in that unknown category. And that was just due to some of the data reporting issues that the state had. So we've got that figured out. And then we'll continue to do our efforts of promoting and reaching out to our BIPOC communities and other affected communities through our ambassador program to make sure we get the message out around the 5 to 11 vaccine and also the booster shots. Next slide. And I've already alluded to a lot of this. The booster shots have been approved by Pfizer, Moderna for certain populations, and then also for Johnson & Johnson to receive a second shot for all of those individuals 18 plus after 2 months of receiving the Johnson & Johnson vaccine. And again, eligible individuals, the FDA approved the mix and matching of these vaccines. So those individuals may choose which vaccine they want to get. And we're seeing this primarily occur with those individuals that receive the Johnson & Johnson vaccine. because the mRNA vaccines have shown such high effectiveness in reducing overall cases, but also reducing hospitalizations and deaths. So we anticipate that we'll continue to see that sort of mixing and matching in that group. And then, as I mentioned before, the FDA is scheduled to meet tomorrow and review the Pfizer COVID-19 vaccine for 5 to 11-year-olds. That will then go to the Advisory Committee on Immunization Practice early next week. And pending approval by both of those entities, we anticipate it to begin rolling out shortly after that. And I already mentioned how many people that will impact in Broomfield. And the state has been doing some polling, and their goal is to have at least 50% of the 5 to 11-year-old population vaccinated by January 31st. My assumption, based on what we saw with our 12 to 15 and 16 to 18-year-old populations, is that we'll see a higher percentage that it's vaccinated in Broomfield by January 31st. And I hope that plays out. Next slide. So as far as what we're doing, the state's working with Children's Hospital Colorado on doing weekly vaccine clinics during evening and weekend hours through December 31st. And they'll vaccinate the entire families and also provide flu shots. Also, they're sharing messaging through the American Academy of Pediatrics, Colorado Academy of Family Physicians, and Immunize Colorado. So basically, they're trying to get vaccines and messaging out to those trusted providers where these children go. In addition, locally, we're working with both Adams 12 and Boulder Valley School Districts to facilitate access to vaccine clinics, potentially at the schools or in close proximity to some of the schools. We're working with our primary care providers in getting enrolled and being vaccine providers for this population. It's exciting to see that Children's North Campus Children's Hospital will be offering those vaccine clinics I mentioned before through those CDPHE mobile buses. And we still have those mobile buses going out to our community events. And lastly, we're working with the metro area and Immunize Colorado on a regional messaging campaign. And the idea is to target parents, but also target some of our affected populations with messages that we know work. So we'll utilize pediatricians and parents as spokesperson to encourage those parents to vaccinate their children. Next slide. And then as far as the policy landscape, nothing's really changed in the Denver metro area. It is interesting to see that the school district in Douglas County is actually suing the Douglas County Board of Health regarding their public health order that says students don't have to wear masks in the school setting. So we'll have to see how that plays out in the court system. Additionally, Larimer County, whereas one of those communities where they're seeing a high percentage of hospitalizations given their population, and also being in close proximity to Weld County, just passed last week a indoor mask order similar to Boulder for ages 2+, and then having some of those we call them passport settings, where if you're fully vaccinated, you don't have to wear a mask if you can show that you're vaccinated. And then, as I mentioned, and it's in the Denver Post today, we had a conversation with CDPHE last week. And given where we're at with statewide hospitalizations, they're also considering what potential policy efforts the state may need to take if we start to see that hospital capacity is going to be breached. And next slide. So I think that's it. And we can go ahead and open it up for questions. If you want to raise your hand if you have questions, and if not, that's fine too. There.
Well, thank you for that update. It's encouraging, all of this news. I'm really excited about the mix and match booster. Do we still need to make appointments for those like we did last time?
Yeah, I'll let Deb answer that question. She's been coordinating most of our vaccine response with all of our providers. Deb, you want to take that?
Sure. Residents have the option. They can certainly make appointments with most vaccine providers, but in addition, most providers are also offering walk-up options, either at their facility or when we have the mobile bus pop-up clinics that we've been scheduling around town. We have both. And so the best place to kind of centralize resource to get information about vaccines is going to our website at broomfield.org/COVID vaccine. We're constantly updating that with the most up-to-date information and any events that are scheduled in and around Broomfield.
Awesome. Thank you so much, Deb. That's all I have. I have a great update. Thanks.
Appreciate it. Councilmember Lim.
Yeah, I was glad to hear about all the efforts to get the vaccines to the 5 to 11-year-olds really quickly. In that messaging, what I think I understand is that the 5 to 11-year-olds are frequently transmitters to more vulnerable populations. So I guess part of that messaging, would be, well, maybe your child isn't at risk, but maybe they're exposing someone else who would be. Would that be the case?
You're exactly right, Councilmember Lim. The research shows that children are able to spread COVID just the same as adults. I think there were some questions around that with the original strain. And then secondly, we know that there's not as severe outcomes with children and adolescents, but what we do know is that they can then go home and spread it to those vulnerable people or go in specific settings and spread it to other vulnerable people too.
Okay, that's good. That will, have that messaging, and hopefully people will listen to that incentive too. Let's see. I had a breakthrough case, so I can't get my booster yet. Otherwise, I could get my booster. But I have actually gotten 2 reminders about my booster. And the first one was conditioned with get your booster if you have certain medical conditions. That was at the beginning of October. And then I just got one today, which didn't have that qualifier. Didn't have anything on it about, it just said, go get your booster. The time is expired, and it didn't have that qualifier about medical conditions. So I was curious, has the guidance on that changed at all?
It hasn't. I mean, the original guidance for Pfizer, they applied to Moderna. And again, it was those individuals 65 plus, 50 and under with an underlying medical condition, or 18 and over with an underlying medical condition. I'm sorry, I said 15 under, should have been 50 and over. And those individuals that work in a high-risk occupational setting where they may be exposed. And I think what is challenging, and we shared this feedback, we just had this discussion today as a team with the state, is it's a little bit of mixed messaging when you're saying, okay, at 6 months, you're eligible to go get your vaccine without actually putting some of those qualifiers on it. So we're telling people when they call us and ask, best advice is reach out to your healthcare provider. And secondly, we have all of that information on our website as far as who those eligible populations are, or if you just type in CDC booster vaccines, you get all those eligible populations as well.
Jason, if I can chime in, I think the other piece of this is that there are those qualifiers for individuals that received their first 2 doses from Moderna or Pfizer. But if you received a dose of Johnson & Johnson and then were fully vaccinated, to receive the booster dose of Johnson & Johnson, there's not those qualifiers about age or medical condition. They're just recommending it. And so I think for simplification purposes, the state, when they sent those texts, just sent it to anyone who may be eligible and fall into any of those categories. So like Jason said, we're certainly trying to have all the updated information on our website and through all our channels. And then certainly when in doubt, please just talk to your medical provider if questions about your personal situation.
Yeah, and I think one last thing I would just point out with this is, the Advisory Committee on Immunization Practices put out their guidance around these vaccines, but they didn't get into like specifying what a high risk occupational setting is. So in the end, it comes down to all self-attestation as an individual. If you feel like you're in that high risk setting or situation, you can self-attest to the fact that you want to get that booster vaccine after 6 months.
Okay, thank you. And I'll just add anecdotally, I was just with the hospital ICU capacity. I'm glad the state is following that. If there's other measures that need to be taken because of that. I was just last week at my oncology checkup at CU in Aurora, and he just came out and said, we're worried. He said, we're worried. He said, we canceled our elective surgeries here. And, I'm worried about, I'm not even going to be able to get my oncology patients in here. So yeah, I'm worried. Yeah, too.
Yeah, thanks for saying that, Councilmember Lim. It really comes down to the fact that those individuals that are unvaccinated are putting themselves at greater risk. And then if they are hospitalized, they're taking up beds, and those are beds that other people may need. And that's what my greatest fear is. We're going to start seeing Broomfield residents that are highly vaccinated impacted and not being able to get other care due to the fact that those beds are being occupied by individuals that are both unvaccinated and hospitalized.
Those are my questions. Thanks.
Great. Thanks, Councilmember Lim. And I don't see any other council members on the call. So that concludes our presentation. We always appreciate the insightful questions, especially from the two of you. And we'll look forward to our next briefing on a Monday and our next briefing at council. Have a safe, and I want to remind everybody, follow our COVID prevention measures over there and have a safe holiday weekend with Halloween. Take care.
We will. Thank you all. See you soon.